And that has to stay. Otherwise, you can lose your board certification too. So it's an ongoing commitment to excellence and patient
If
safety.
the plastic surgeon sort of gives off the vibe that he or she can do anything or everything that will lead to riches and glory, that's a bit exaggerated. That's a bit over. That's a bit too much.
Along the online reviews, it's worth noting them, seeing what is being said, but you can pay for reviews. It's hard to know like how many of those are real or not. People can go out and there's cyber attacks where people will leave bad, like bots will leave bad reviews and they'll hold businesses, which includes surgeons, hostage.
And even then, people sometimes hyper specialize in certain things. So I think that's important that you find someone who is comfortable with doing your type of procedure.
The beauty scientists, Dr. Kristy Hamilton and Dr. Roy Kim. Real beauty without the hype.
Welcome to the Beauty Scientists. We are board certified plastic surgeons. I'm Dr. Kristy Hamilton, and I'm here with my colleague, Dr. Roy Kim. And we have a very exciting topic today, which is how to choose the right plastic surgeon. And I think of all the things we've talked about, this is probably one of the most important because it is the foundation of patient outcomes and ultimately patient safety. How are you doing, Dr. Kim?
I'm doing great. How are you doing?
Great. So where would you start? So what do you think is the most important component if you're a patient, you're starting to sift around on the internet? Like, what are the foundational elements that you need to check?
The foundation is always, of course, our education. And it's important, although as we talk more, I think it's slightly less important in bigger cities because board certification matters, our training matters, our results matter, and board certification does mean a lot. But to be honest, in bigger cities, there are several choices for board certified plastic surgeons, and board certification really means yes, we take a written and oral test. And also, we're part of the ABPS, American Board of Plastic Surgery. That is the original plastic surgery fellowship training program that's part of the nerdy ABMS, American Board of Medical Specialties. What that means is that we can operate in hospitals. We can get certified or sanctioned at hospitals. And we have transfer privileges and all that stuff. A lot of the non-ABPS plastic surgeons, they can call themselves plastic surgeons. It's not a trademark name. They really couldn't, they're not allowed to operate in a hospital setting.
So that's a great way. That's a great litmus test to find out. So if you're speaking to someone and they're saying they're a plastic surgeon, and you're there for liposuction, and you say, okay, can you perform liposuction in one of the hospitals in town? If they can't answer yes to that question, they are not a board certified plastic surgeon because it's one of the requirements from our board. And also, you mentioned ABMS. Those are the real boards of medicine, and the American Board of Plastic Surgery is one of them. There's some fake ones out there, clubs really, such as the American Board of Cosmetic Surgery, that is so confusing. It sounds legitimate, sounds like a real board of medicine. It's actually a club. You do need to be a doctor. You need to pay $700 and have a reference from one or two other people in the club. That is not what board certification looks like. To your point, it is medical school, at least 6 years of plastic surgery training, if not more. A lot of plastic surgeons do 8 years of training or longer. And then we're held to a high standard, have passed all those board exams, and have to maintain our credentials, operate in safe facilities, and we're held to this standard by our peers. So that's really, really important.
Yeah, I totally agree. And for our listeners and viewers out there, that's the difference. I mean, ABPS does mean something.
And it's always good to know that the surgeons we're like vetting each other also too. So the American Board of Plastic Surgery, they check in with us. We have to maintain, we have to prove that we're maintaining our education, prove that we are constantly learning, show that we're operating in accredited safe facilities. And that has to stay. Otherwise, you can lose your board certification too. So it's an ongoing commitment to excellence and patient safety. What do you think is the next most important? So that we just check major box, like that you actually have a plastic surgeon who's safe. What's next important?
Yes, I do think that even as plastic surgeons, it's such a massive field there's lots of things that we can do that we definitely have our preferences as to what exact procedures we like to do. The plastic surgeon that you choose or that you like really should be able to talk a lot about the procedures, possibly give lectures about it, possibly have done research in it, and definitely be able to show you before and after results and really speak knowledgeably about whatever you're interested in. So I think the classic ways of breaking it up are face, breast, and body. And even then, people sometimes hyper specialize in certain things. So I think that's important that you find someone who is comfortable with doing your type of procedure.
Yes, I think looking at before and afters on the internet so important. So every plastic surgeon's website, you are seeing what they deem to be their best results, at least from the group of patients that are willing to share their photos. And we can talk about that too, because it's oftentimes easier to get photos for breast and body than it is for facial procedures for the obvious reasons of patient anonymity. But if you look at the website and that aesthetic is lining up with yours, like great. That's a good starting point. If you look at the website and you're like, ooh, that's, the breasts are too big or too small, or those noses I don't think are cute, then that's probably not the surgeon for you. It doesn't mean that they're good or bad. It just means that their aesthetic is not aligning with yours. So you want to find someone who their patients match the results that you're looking for. And to your point, you want to go with someone who is doing these operations routinely. So that's important. You can ask your surgeon, is this something you specialize in? Do you frequently perform this procedure? Those are how many of them have you done? These are all really important questions. And obviously someone who's been in practice for 30 years will have done more than someone who's been in practice for 10. But you want to know that your surgeon does this on a semi-routine basis, particularly if it's a commonly performed operation. I think next most important is probably reputation, I would imagine.
Yes. So this is where I think we both may have a love-hate relationship with online review sources, because not only is there Yelp as well as Google reviews, there's also something in plastic surgery known as Real Self, and there are others which I think are more minor. So I think those are semi-important to important, not necessarily the most important, because again, I find that patients, especially with Google, they don't really love leaving their real name to make a review. They don't really care if it's a restaurant. They obviously care if it's plastic surgery. So it is, I think, a little more difficult to find reviews. Now, of course, if someone has lots of bad reviews, maybe that's a red flag. I think also the flip side is someone who has lots of good reviews, I actually look upon those with skepticism as well. So I think it's a balance between that as well as talking with your family and friends. In other words, word of mouth. I think by far word of mouth referrals are the best way to go. But definitely pay attention to the stuff that's online.
I completely agree with you. I think I love when I see patients who've been referred by other current patients of ours, because it's one level of familiarity already. And I agree with along the online reviews. It's worth noting them, seeing what is being said, but you can pay for reviews. It's hard to know like how many of those are real or not. People can go out and there's cyber attacks where people will leave bots will leave bad reviews and they'll hold businesses, which includes surgeons, hostage and saying they won't delete the reviews until you pay them. So it's take it with a grain of salt, but it's worth perusing those. And finally is another component of reputation, similar to being board certified. Most plastic surgeons are part of various professional organizations, namely the American Society of Plastic Surgeons and also the Aesthetic Society as well. Those are the two main ones for aesthetic plastic surgeons in the United States, and other governing bodies that we kind of monitor hold our members to high standards. So I know you and I are both members of those.
Yes, and we've given lectures and we're on various committees. So we're definitely more involved in plastic surgery than even the average plastic surgeon. But again, even that in and of itself is not the ultimate, even though I love tooting your horn and my horn, it's not the ultimate way of choosing like a really great plastic surgeon, but it does help.
It does help. And I think more in line with the being board certified. So step 4. So you've perused the internet, you've asked your friends, you've vetted your surgeon, checked out the medical boards from their states, make sure everything looks kosher. Now you're in the consultation room. What questions would you ask your potential plastic surgeon?
I think even before you step in, you want to do as much research as possible. And you want to actually get your questions answered about your specific case. I think a lot of times with social media and the internet, we're able to explain, and patients actually come in with fewer questions about generalities, like, are you a candidate? What's the procedure? Oftentimes, patients often come in with a very, very good knowledge of an approximate price range, even before asking my office. I think the big thing is going over the details of your specific case. And this may sound a little strange, but it's true. It's the vibe or feeling or bond or psychological bond that you feel with your plastic surgeon. Because both Kristy and I are probably assuming that you've done your homework and you're seeing a real board certified plastic surgeon.
Yes. So at that point, it really is, it's a two-way relationship, right? So we as the surgeons, we want to feel very comfortable with the patient. I like to feel that I've gotten in your mind, I know what you want, and that I feel confident that I can deliver that for you. So, and the patient needs to feel comfortable with me that I similarly can do what they're asking me to do. So that's really, really important. And that's what we really should be able to gauge during the consultation. If I feel like I can't deliver the result that the patient wants based on a variety of reasons, then that's not the right bond. So that's what you should walk out of the office feeling really, really good. All of your questions have been answered, gone through all those checklists, and you weren't rushed, you were welcomed, and you feel that sense of comfort and well-being. Next, you have to consider, I think, the team and the facility. So who's taking care of you? Where is it happening? And you want it to be an accredited facility. You want to be with accredited staff, meaning registered nurses where appropriate, anesthesiologists where appropriate, because again, you can have the world's best plastic surgeon. If they don't have the right tools and the right people around them, it's impossible to deliver the result that you're expecting.
Absolutely. The accreditation is easy at a hospital setting. And so, hey, if the surgeon can actually operate at the hospital, that's a very high level of safety, and also they've been vetted. In terms of the surgery center, it depends. So what's interesting is that there are different organizations that are accredited, but essentially you want to be fully accredited. What that implies is that we can do health insurance cases, Medicare / federal government insurance, which is pretty much the highest standard available in the United States. The team's also important because we're able to deliver general anesthesia if needed, which again is sort of the deepest level of anesthesia that you get for virtually every, plastic surgery procedure that requires a longer sort of time in the operating room. And that person that is delivering the anesthesia should be a certified CRNA or MD anesthesiologist. They've also been vetted by the facility as well as by the plastic surgeon so that your ability to go to sleep and wake up is also very safe. So those are the things that maybe are nerdy details, but are very important for patients.
Yes. And a nice touch, I like working with the same people all the time, and it's not necessary to have great results, but I think it's a really nice touch that we know that we are working with the same people, same expectations, every case, know the way that we do things, how the case is going to go, and that allows for like great synergy in the operating room. Not necessary, but it's a nice touch. Financing, that's like another interesting component of choosing your plastic surgeon. So my perspective on this, I imagine yours is similar, is that it should just be like very, very clear and very, very transparent. So when patients leave the office, they should know what the total cost is going to be, potential upcoming costs that could happen, and what three common things for surgery are surgeon's fee, facility fee, and then anesthesia. Sometimes those are all combined into one. Sometimes you're only getting a component and you'll get separate bills from facilities or anesthesiologists. Just want to make sure that you know what's coming your way so that you can plan appropriately and don't have any surprises.
Yeah, I think a couple of the finance details include medical or surgical supplies. So of course, if you're getting a breast augmentation, there are breast implants. Sometimes there are additional costs for internal bra. Sometimes there may be an additional cost when I'm doing a facelift and I need to use the laser. There's a slide up charge for that because someone has to pay for use of the laser or the actual device. Things of that nature. It's very important to know that ahead of time.
And finally, what are some red flags? Like what if you saw this, you'd be like, run.
From a patient or consumer perspective, if the plastic surgeon sort of gives off the vibe that he or she can do anything or everything, that they have outstanding or unrealistic expectations for a spectacular, beautiful result that will lead to riches and glory, that's a bit exaggerated. That's a bit over. That's a bit too much. So, yes, it's a two-way communication street, as you mentioned. In other words, the patient has to sort of have certain expectations, but the plastic surgeon not only has to deliver, but actually has to be realistic because we're operating on patients, on humans. And it's important for patients sort of to feel, that plastic surgeon that I saw didn't overpromise, didn't, say, my life's going to really change. They sort of have to focus more on the procedure. I think that the other thing is, in terms of communication, you want to feel comfortable communicating with your plastic surgeon. Things can happen, or things that patients consider minor, plastic surgeons consider major. I think the reverse is also true. Sometimes things that patients consider major, plastic surgeons truly consider minor. But that's okay because, patients are not doctors. So the ability to have that two-way communication, feel comfortable as a patient asking questions is vital.
Yes, and as a patient, you have to be able to get in touch with your surgeon if necessary, whatever way that is. Every office has their own way, but you should be able to freely communicate with the team no matter what is going on so that all your questions are answered. Also, so you feel good as you're going through the healing period. Because what I tell patients is, look, this is what we do every single day. We know what's normal, what's not. Even things that may feel like they're abnormal are often very routine. To be able to voice those concerns and then therefore feel comforted as you're going through them, knowing you're going to come out on the other end in great shape.
Absolutely. Is there anything else that's hidden that you think is sort of a red flag?
No, I think open, clear communication, like you said, the vibe check is very good, but you also want to do all your homework. I think if you have a good energy, good communication and clarity with the surgeon, it feels like you're in a good, safe environment, and then you've checked all the standard boxes, then I think you're in good hands.
Yeah, I totally agree. I think it's vital to have a fantastic relationship.
So I hope you all learned something from this conversation as you're choosing your board certified plastic surgeon for your aesthetic procedure. Let us know if there's any other things that you considered that were important to you when you were deciding. And we're always interested to hear back. Stay beautiful.
As always, stay beautiful.
Thank you for joining us on The Beauty Scientists. Be sure to visit thebeautyscientists.com and learn more about modern beauty and connect with Dr. Hamilton and Dr. Kim.